Thank you, Jackie, Brooke, and Lauren. Now we're going to move on to implementation and evaluation. So, Mrs. MJ was diagnosed with an ischemic stroke at the ED. Our priority nursing goal is to increase cerebral tissue perfusion. So, firstly, we're going to administer TPA immediately because she is within the narrow time frame of 90 minutes from onset. Secondly, we're going to address patient safety by putting her on bed rest and NPO status. This is because she has a decreased level of consciousness and she has disturbed gait and balance. Thirdly, we're going to confirm airway patency, reassess vital signs and blood glucose levels. This is to evaluate the effectiveness of our interventions as well as plan future interventions. And blood glucose levels are important to monitor because they can predict the size of the blood clot and the infarct. Fourth, we're going to initiate fall precautions and seizure precautions. This addresses patient safety as well. Next, since we have ensured our patient's safety, we're going to attempt to build rapport with our patient. Since Mrs. MJ is experiencing aphasia at the moment, we're going to give her options to communicate. So it can be very frustrating for a person experiencing aphasia to try and not be able to speak. So we're going to allow her to either write down her communication or speak it if she can. Next, we're going to provide psychological support to the patient and their family. Stroke patients have a huge risk for depression, so we're going to assess that once Mrs. MJ is stable, and especially prior to discharge. If the patient is afraid of long-term disability, reassure her that her chances of rehabilitation are quite good since she administered TPA within the narrow time frame. Lastly, we're going to provide patient education every step of the way. So we want to tell her about the treatment she's receiving and definitely educate her about anticoagulants and antihypertensive that she will most likely take once she is discharged.